Alright, so here we have the bones of the lower limb, and again these are all from the left hand side of the body, so we're looking here at a left hip bone. Now remember that the hip is considered to be one bone in an adult, but it is actually made up of 3 separate bones in a child, and they're often still referred to as being separate. So if I put a line across here, everything above that line, everything superior to it, is the ilium. So all of that is the ilium, and here we're looking at a lateral view of the hip. If I then put a line through this part of the hip, everything posterior to that line from here is the ischium, so below the ilium, but then posterior to that line is the ischium, and everything anterior to that line is the pubis. So obviously this is the posterior aspect, this is the anterior aspect, and that's a lateral view, a left hip. Now some of the features we need to look at here then are this rather obvious anterior superior iliac spine, and that's quite palpable in most people. From there, if we travel posteriorly, we're moving along the iliac crest. So the iliac crest runs all the way to here where we have the posterior superior iliac spine. And then also visible on the lateral point of view is this socket here, which is called the acetabulum. And that's where the head of the femur is going to sit. That's where your hip joint is. Now if we then move to look at a medial point of view, we can see there's a depression here that's called the iliac fossa. And now looking at a left femur, you're looking at an anterior point of view. This is the anterior surface here. And like with the humerus, you can hopefully immediately see that the two ends look quite different. This is the proximal end where we have the head of the femur and then the neck. And the neck is a place that's often involved in fracture. So we have the head and neck, and then the greater trochanter, which is on the lateral aspect, and then the lesser trochanter, which is on the medial aspect. Then if we move distally, we have the shaft of the femur, and at the distal end there are 2 condyles, and you can see them better from an inferior point of view, where we have a medial condyle and a lateral condyle. And again, if you're looking at the distal end and you're thinking which one's medial and which one's lateral, just look up at the proximal end where you can see that the head is medial. So the head is medial, greater trochanter lateral, and that's the femur. Now looking at a left tibia, and here again we can see long skinny bone. Proximally we have on the anterior surface a structure called the tibial tuberosity. And then as we travel down the shaft, we have the medial surface of the tibia. Now the medial surface of the tibia is important and easy to find because it's commonly known as your shin bone. That's what people usually point to or feel when they say this is my shin. It's the medial surface of the tibia. At the distal end of the medial surface we have this bump which is the medial malleolus, and again that's really very palpable. You can easily feel that bump around the just superior to the ankle joint on the medial side. So we have tibial tuberosity, medial surface, and then medial malleolus. And again, it's easy to spot which is the proximal end with this distinctive shape and the distal end with the medial malleolus there. And you easily can tell which side is medial if you're looking at a tibia, because the medial malleolus has no opposite over here. There's nothing there on the lateral side. And now the fibula. Now it's a little tricky to tell which is the proximal and distal ends. So you'll kind of have to take my word for it. This is the head. It's a little squarer, a little more chunky perhaps than the distal end. So there's the head. It has an articular surface on its superior aspect, a smooth region there. Then we have the shaft, and notice it's a really skinny bone. And then at the distal end we have the lateral malleolus, and again that's really very palpable. You can easily feel that just superior to the ankle. And now here we have a foot, and this time we actually have a right foot rather than the left bones we had previously. Here is the talus, which is the most superior of the proximal tarsals, and that's where the medial malleolus will sit right here, and the medial malleolus will sit right here, the lateral malleolus will sit right here, and that's where the tibia and fibula articulate with the foot at the talus, and that gives you the ability to plantarflex and dorsiflex the foot. Just distal to the talus we have an even larger tarsal called the calcaneus, and that's your heel bone. Well, that's what's commonly called the heel bone. So we have talus and calcaneus, and then there are more tarsals here, which we're not too worried about the names of them at the moment, but there's another 5 there. And just note that they're a lot bigger than the carpals that we looked at in the wrist. But like the hand, we then have, in the hand we had metacarpals, so here we have metatarsals. So here we have the first, second, third, fourth and fifth metatarsal bones, and then we have again the phalanges, and once again with the first digit there are 2 phalanges, and then with each other digit there are 3. So you have a proximal and distal phalanges in the first digit, proximal, middle and distal with each of the other digits after that. And that's the foot.